Welcome to Mayo Clinic, Florida. I am Dr. Margaret Johnson, Dean of Education. Medical education has been a cornerstone of Mayo since our founding over 150 years ago. At Mayo Clinic, Florida, we are honored to provide graduate medical education to over 250 learners each year. Today, as we provide you a tour of our campus, you will hear from a few of our many graduates who are shaping the landscape of medicine.
What the Mayo Brothers did was they recognized that they needed to see what was out there. What were people doing different than them? What could they bring back to improve the care that they were providing, to improve the experience that their patients were having, to differentiate themselves in services that they provide? And so that's what I did. I was a general surgery resident. When I finished, I went and did a breast surgery oncology fellowship at Memorial Sloan Kettering. And then I came back and then developed that program here on the Florida campus.
The campus at Mayo Clinic in Florida opened in 1986 and sits on 400 acres of land along the Intercoastal Waterway, about 3 miles east of the Atlantic Ocean. Patient care is centered in a 5-building complex, which includes the Mayo Hospital and Mayo Building, as well as the Davis, Canada, and Mangurian buildings. Mayo Clinic Hospital is an 8-story, 304-bed facility with expansion plans of up to 17 floors and 550 beds. Our surgical space is home to robotic surgery rooms and hybrid vascular suites equipped for complex procedures, as well as intraoperative radiation devices utilized for cancer care. Our radiology department is equipped with phenomenal reading rooms, multiple interventional radiology suites, an artificial intelligence lab, and a newly installed 7 Tesla MRI to complement our current fleet of scanners.
Innovation is in Mayo Clinic's DNA. STAR-X is an abbreviation for simulation, telemedicine, robotics, and experimental education. It's a blended, innovative fellowship that is about 12 months, but brings together these different disciplines to really provide what we feel aligns with our 2030 plan of training the next generation of physicians, scientists.
The Mangurian building opened in 2018 and is home to our neurology, neurosurgery, hematology, and oncology departments. Next door, the integrative oncology facility will soon be constructed, which will offer proton and heavy ion cancer therapies.
As a surgical trainee in the Department of Urology, the biggest honor in my career was the fact that those who trained me asked me to stay on as staff in the Department of Urology. I think that the trust that's grown between mentor and mentee, the trust that's gained between staff and student is unmatched, and I think it's a natural progression to go from a training program to staff in the Mayo Clinic system.
In a short walk from our patient care buildings, you will find our growing research complex on campus. This includes the Birdsall and Griffin buildings, where much of our neuroscience and cancer research is performed, as well as the nearby Discovery and Innovation building, which is the home of our Lung Bioengineering Center. Our residents participate in a variety of unique learning opportunities in the Jay Wayne and Dolores Barr Weaver Simulation Center. There are mock exam rooms, standardized human patients, a procedural skills lab, high-fidelity mannequins, anatomage table, and virtual reality experiences.
I always said I wanted to pursue a career that allowed me to combine both neurology and palliative medicine, and I had to find a place that would allow me to do that. The kind of care that we provide here is really unparalleled, and Mayo has allowed me to be really creative in my career choice. And so as a neuropalliative care physician, it's really a non-traditional career path, and I'm just so grateful that Mayo's been so supportive in allowing me to pursue that.
West Campus is the site of the Basso Sleep Center, McGraw Community Hospice, and both the Gabriel House of Care and Hope Lodge, which provide housing for patients and families awaiting transplant and receiving complex cancer care. Off campus, our residents have the opportunity to serve our local community at the Sulzbacher Center and Mission House, where free care is provided for Jacksonville's homeless population.
The members of Mayo Clinic are only as strong as the members of the community, and they're a part of that community. One of my main goals as chair of community engagement has been to make that connection a little bit easier. And that's a connection that's easier to patients, that is offering opportunities for our trainees to care for and deliver content to these patients, but also for our employees specifically, to know where these opportunities exist.
Mayo Clinic gives a unique vantage point, a great platform for us to be able to network outside. It gives us the opportunity to be the leaders on committees that then allow you to network with other people and collaborate across institutions. And I think it just enriches the experience, not only as a clinician where you learn from other colleagues, but again, it diversifies research, which is really important because we do see a diverse set of patients.
Mayo Clinic provides an unparalleled opportunity for you not only to learn in your clinical practice and become the very best you can be, whether it be surgery or medical subspecialty, but also become an incredible teacher to the younger generations of residents or fellows that follow you. I can't think of a program or another institution that rivals our resources and that mentoring, nurturing environment.
Mayo Clinic in Florida is a destination medical center where patients are welcomed into a healing environment with all of the marvels of modern medicine. Residents will thrive in the supportive culture of collaboration and teamwork. Many of our former trainees, myself included, established firm roots here in Jacksonville during their residency days, and you too might find it hard to leave after graduation.
If your goal is to be a great physician, then the Mayo Clinic is the right place for you, because that's what we do. We train excellent physicians.
If you're looking for breadth and depth, you'll get it here. If you're looking for common medical conditions, you'll see it here. But if you want to go to a place that'll really challenge you to think beyond what you may be challenged to think about other places, then Mayo Clinic may be the place for you.
I sincerely hope you join us to further your medical training at Mayo Clinic, Florida, the #1 hospital in Florida.